मेरी अपना करो. So I'm continuing alcoholic disorder. It gives rise so many complications. And in fact, it may affect any part of body. It affects CNS. It gives rise metabolic disorder. It gives rise various legal problem and the cancers, and it affects all part of body. In CNS, it gives rise very important that syndromes, Wernicke's Korsakoff syndrome, dementia, cerebellar degeneration, peripheral neuropathy, myopathy, and head injury may be most commonly associated with the alcoholism. Ketoacidosis, hypoglycemia, hypercalcemia, hypomagnesia, magnesemia is one of the complications of alcoholic dependence. It gives rise to fetal alcoholic syndrome, and osteoporosis, tuberculosis is more with the alcoholics. Psoriasis is well-known complication of alcoholic dependence. It gives rise, already I said that alcoholic are more prone to the accidents, a large number of cancers, oral, esophageal, and colon occurs because of alcoholic. Measures, various type of measures are there for the various alcoholic drinks, and one drink of beer contains about 330 ml. One drink of malt liquor about 266 ml, and spirits 30 ml. Table wine 150 ml. These are various measures. Beers, second is of the various spirits, third is of the wine, and fourth is other type of the whiskey, gin, and vodka preparation. It well absorbed through the mucosal lining of digestive tract in the mouth, especially esophagus and stomach. The most prominent area of uptake is 90%. However, it is in the proximal area of the small intestine. Faster absorption occurs when stomach is empty. From digestive tract occurs absorption will late if the person takes with the alcohol with the food. Carbonated beverage with beverages containing 15 to 30% alcohol, slower drinking effect. After its absorption, it enters bloodstream rapidly and distributed throughout the body. Peak blood concentration of alcohol is reached in 30 to 90 minutes, and usually 45 to 80 minutes. Tissue containing high proportion of water receive high concentration of alcohol. Metabolic alcohol follow zero order kinetics. Tolerance, already it have been described that more and more doses are required for the same effect, and it is maybe behavioral tolerance. A person learns through practice how to perform tasks effectively while experiencing the effect. Secondly, pharmacokinetic tolerance involves the adaptation of alcoholic metabolized by metabolizing system to the rid of the body alcohol more rapidly. Pharmacodynamic or cellular tolerance reflects an adaptation of the nervous system so that it can function despite high blood alcohol concentration by resisting the action of alcohol on cells. Once tolerance has developed to one depressant, an individual is likely to demonstrate a similar action to a second drug of the class. Blackouts is the phenomena that very commonly observed with the alcoholics, with the cases of alcoholic dependent person, and a blackout is a memory impairment for the period when person was drinking heavily but remain awake. But after that, he doesn't remember that where he was during that period of time. It gives rise a lot of cardiovascular complications. High alcohol drinking may lead to the withdrawal symptom, can increase blood pressure and elevate both LDL cholesterol and triglycerides, enhancing the risk of myocardial infarction and thrombosis. Alcohol cardiomyopathy is well-known complication of alcohol dependence. Cancer uh, occurs very often with the alcohol dependence. It's head, neck, esophagus, stomach, liver, colon, lung, and breast tumors all may be occur. All of them may occur with alcohol dependence. Alcoholic-related immune system suppression and direct effect of ethanol and aldehyde on mucosal membrane may lead to a lot of vulnerability of various infections and poor immunological response. It gives fetal alcohol effects. Both alcohol and aldehyde substances cross the placenta, and high enough doses can produce death and partial abortion of the fetus. Fetal alcohol syndrome occurs at least 5% of surviving infant. It gives rise low IQ, low small, yeah, low birth weight, small head, and facial abnormalities are very often found in the children with the fetal alcohol syndrome. Flat bridge, nose absent, uh, clitorium, and epicanthal eye holes, and arterial septal defects, and syndactyly occurs. Impulsivity and disinhibition is one of the also complications characterized by the antisocial traits where the risk of IOD is about 80%. And schizophrenia and bipolarity reflect the poor judgmental and the mania and low level of responsibility to them. Now I'm taking cannabis. Cannabis is a hemp plant and it is derived from the cannabis hemp plant. It is also known as marijuana and it has short-term effect like when a person smokes marijuana, the psychoactive active compound from it passes through lung into the bloodstream. The blood carries the chemical to the brain and organ throughout the body. The body is no part of body. I think the depth where it doesn't reach it. Uh, its effects are slower. The person takes drink marijuana or cannabis with the food generally feels with 30 minutes to 1 hour after it's okay. More activity starts in brain that contains higher number of these receptors. The high that people feel, the effect includes altered altered sense of time, changes in the mood, impaired body movements, uh, difficulty with the drinking and problems, impaired memory, hallucination, delusions, psychosis. Marijuana also affects the development. When people begin using marijuana as teenagers, the drug may impair thinking, memory, learning, function, and affects how the brain builds connection between the area necessary for their function. Researchers at the Duke University shows that the people who started smoking marijuana heavily in the teens had an ongoing marijuana use disorder, lost an average of 8 IQ points between 39 years. Cannabis, you see that it active compound is THC, trihydrocannabinol. This is a hemp. This picture shows sadhus taking cannabis and this bhang drinking by the person. Cannabis disorder have been described in DSM-5 as cannabis use disorder, cannabis intoxication, withdrawal states, other cannabis-induced disorder, and cannabis-related disorder. This cannabis in toxin-resistant use cannabis creates significant problematic behavior, psychological changes in the form of anxiety, phobia, slow time, means withdrawal that develop during the shortly after cannabis use. Only two of the following signs develop within 2 hours of cannabis. Conjunctival ingestion, increase appetite, tremor, and tachycardia. Cannabis withdrawal when persons stop taking it, it develop withdrawal symptom. Cessation of cannabis leads to heavy and prolonged the effects. 3 or more of the following symptoms may develop within 1 week uh, of the heavy prolonged use. The for irritability, anger, uh, and aggression, nervousness, anxiety, sleep difficulties, decreased appetite or weight loss, restlessness, and depression. At least one of the following physical symptoms cause significant discomfort, abdominal pain, shakiness, tremors, sweating, chills. The signs of symptoms are clinically significant distress, impaired social occupation, parted area functioning. Cannabis-induced psychotic disorder. Presence of one or more of the following symptoms: delusion, hallucination, evidence from district examination, laboratory finding. Following symptom, interest connection develop during the sexual substance withdrawal. The involving substance capable occupation these symptom. Disturbance, cannabis intoxication may be sort of delirium, disturbance attention, disability to direct focus, sustain attention, additional disturbance, cognition, the memory deficit disorder, language, and visual expression from there. Other effects are the increased appetite, visual distortion, lack of concentration, paranoia, feeling impersonal, panic disorder, emotional syndrome. Now I'm coming to the opiates. Opiates are maybe maybe seen available in the natural form, a crude form, morphine and DODA. Synthetic heroin, methadone, its medical use and non-medical use, oral injection, uh, inhale. You see, these are the people are taking injective form of the opiates. They are putting this is the usual approach of smoking heroin. They put the heroin on this paper of file. From there, they ignite from below, and after heating up, they start smoking it. And it may be so severe effect that you can know after toxicity. This picture shows maybe person may have lost the where they are. Intoxication leads to frequently leads to just relapse and present with intoxication. Symptom may occur at level of intoxication varies. For mild and moderate intoxication individual, may present with drowsiness, poor conditions, constriction, and slurred speech. For severe form, may experience respiratory depression, stupor, coma. Severe overdose may be fatal. Withdrawal state. For important person, the effect is very painful and severe. And because these with painful symptoms, person is try to avoid this state and keep on taking kind of that opiate substances. Autonomic symptom occurs in form diarrhea, rhinorrhea, diaphoresis, lacrimal sensory nausea, dementia, and alorexia. CNS arousal may lead to sleepiness, restlessness, tremors, abdominal cramping, bone pains, and diffuse muscular aching is one of the important symptoms. And last, the least is for craving for the medication because of severe side. Opiate substitution, overdose with bupropion, and and other substances are used for the management of opiate dependence. So its management could be of two types. Is one of the uh, substitution treatment. Other is a gradual withdrawal and patient making away from it. Now coming to heroin, very important product that we use. And the people if I inject, sleep or snort or smoke, or some people mix heroin with a crack, okay, and its short-term effects heroin produces rust, which there is some effect, including dry mouth, warm pressing of the skin, very high feeling in the arms, nausea, and severity, clouded mental functioning, going on the north, a black and both state of being conscious and semi-conscious. Long-term effect includes insomnia, collapse when people who inject the drugs, damage to inside nose and people who sleep, infection of the heart, liver, and lining of the walls, constipation, stomach cramp, liver and kidney disease, and mental disorders like depression and antisocial personality are one of the important presentation. Sexual dysfunction, menstrual cycle disturbances occurs with it. Now to the sedative and effects. There are uh, uh, three groups: benzodiazepine, barbiturates, and jet group products. And benzodiazepine for alprazolam, natamate, diazepam, and clozapam, clozapam. Buprenorphine, they are used at present, but that in fact benzodiazepine because of addiction, they are not available now in the people market in India. Then barbiturates, still a number are there. It should is have been replaced by the jet drug that is zolpidem. Uh, uh, Benzopine, benzopine misuse is associated traumatic crimes, shoplifting, lifting, property looting, crimes, drug dealing, violence, segregation. He used to murder of civilians. It temazepam and metalopam, most substances. Alprazolam has been used by the purpose of carrying out the act of the incest. Some benzodiazepines are commonly associated with crime, with others especially when caused with municipal crime. They are inhalant with a large number of groups. They are uh, they are various type of the addictive substance which are inhaled and it has a lot of severe side effects and it could maybe you see various uh, that pen remover, it may be, or that nail polish remover, or other that spray. Here you've seen the people have used alcohol, even people have used. It affects brain, your tremors, dysphoria, seizure, headache. In the personality, memory loss, decrease cognition, and you have hypoxia, sinus discharges, sinus upper lower. This is on heart, it affects your irregular heartbeat, first degree of heartbeat, arrhythmia, and sudden and shift, anything, death syndrome may occur. Abdominal pain, nausea, cirrhosis is very common after. It gives kidney stones and complete loss of kidney. It affects one muscle very badly. Large, it will make a lot of body, musculoskeletal system. Psychiatric sometimes includes impaired judgment, confusion, anxiety, includes psychosis, increased violence, dementia, impulsiveness, decreased attention, social and education. So nowadays there is trend of new drugs called party drugs. They are ATSC, ketamine, gamma hydroxybutyrate, rohypnol, elastic, ATSC, ketamine, and methyl. Club drugs tend to be used in teenagers, killers, nightclub consent with party. Now, club drugs users are generally taking the drug to enhance social intimacy and serious stimulation. Some club drug properties stem from their ability to induce euphoria and lower inhibition by these drugs during intoxication. If they are not aware about the time test person. And some club drugs such as LSD, DMT, MDMA, 2CB, and ketamine enhance experience of being here and pulsating. Lights and pleasure. Now coming to tobacco, that it is a huge smoke, used for nasal uh, methods by snuff, and it might be applied inside the mouth called the kudaku, creamy snuff, mystery and wool. This first how the person starts. This is one of the gateways. For prepare, try, experiment, language, right dependent. These are preparation various type of item by the person. These are the person you can see sitting on the pawn shop telling the tobacco smoking can lead to lung cancer, chronic bronchitis, and emphysema. Is a risk of heart disease which can lead to stroke and heart attack. Smoking has also been linked to other cancer, leukemia, and cataract type 2 diabetes. All these risk ability to the risk of the workplace. Tobacco increases risk of the cancer, especially mouth and cancer. So this is one drugs that needed to be covered. Now one more thing that substance abuse is more is in India less common. Why? Now coming to treatment. Why treatment is very important? Because it realizes so many complications. Physical complications, psychiatric complications, social complications, and legal complications. And Management of acute syntax overdose may withdraw in type level 1. And so more relief person is falling to compressed psychosocial therapy. There are certain myths about the alcohol and drug abuse. That beer is not harmful, but it has same effect as other drugs. Red wine is always, it is never should be accepted. And wrong and ganja are cultural, cultural bowel syndrome. And does not have a bad, it is not. Drug abuse is voluntary. Listen, and so treatment may be in the community setting, or in the OPD, or anywhere. Experience is more important, primary, secondary, tertiary. For parents, it's possible first to reduce demand, primary, and decrease production. Past experience has shown in the large number of newer drugs they came and by taking it can categorize certain huge criminal incidents. Drug abuse is a brain disease. One has to understand first. This abuse is increasing. It has physical and psychological complications. It has social and personal rise, legal complications, and its prevention is possible. So prevention is, I think, that most important should be considered and to prevent complication